Mountain View Hospital was an idea that came from a physician component. Physicians wanted to be involved in the direct component of care and to provide a sense of security for patients to have both believability in their care model and also the NICU, which is the #1 focus. So we thought, how can we continue to increase that level of care for the baby's needs so they don't have to be separated?
We've always had a NICU here, but we weren't quite able to do as much as other NICUs. As the community grew, we saw that need and we started looking to fill it by creating a larger NICU.
Everything was a little bit more cramped. The bays were smaller and just all the equipment, you were just trying to, cram it in as close as you could so that you could get everything in that you needed.
We wanted to go from a little tiny 2-bed NICU to turn it into a really focused NICU. Our NICU before this point was just limited into the stabilize and get them to a higher level of care.
It was clear that the community needed more places to care for these sick babies, and us expanding to a level 3 NICU will let us really be able to keep our families together in the event that something does happen.
Family-centered care was the vision when we built this NICU, so that we would have enough space to adequately take care of our infants, which has been proven to have high-quality outcomes in neonates.
Mountain View wanted to do more than just kind of create a NICU. We wanted to create the best NICU in the area. So we shot for the moon. We went for the best.
Quality and patient outcome is the forefront. Before economic, before any type of development, you must have the patient be the centric focus. So as we put the team together, we put clinical components, we put supply components, we put equipment components, capital components. What is needed to provide that high-level patient outcome?
We started collaborating over 1.5 years ago with different team members to try to decide what we would need to get, who we would need to have, where we would do it within the hospital. I felt a little overwhelmed to kind of be thrown into it as a clinical person. I have management behind me, but I've never done construction before. But I did know we had not a lot of time to do something.
So we broke it up into 2 phases of construction. This is the first phase. The second phase will double the size that we have currently.
The first vendor selection process is to find someone that has a vendor that has a similar vision to us, that is willing to work with us and effectively, I cannot emphasize enough, effectively communicate with us.
All of our neonates' problems are respiratory driven. So if we can provide amazing respiratory care, we're going to have good outcomes. So picking the top of the line in respiratory care led us to Dräger.
Recruiting excellent nurses is one thing that we have really been focusing on, with the growth of this NICU, and the state-of-the-art equipment really is a selling point. And I think it shows to them that we are invested in taking good care of these babies, and a lot of nurses really want to be a part of that.
We tried to bring a calming environment for the family because the infant is there just to work on life-sustaining measures. But the family is there during a stressful time.
So the new NICU that we've moved into has its own personal space for each neonate, which allows the mom and the dad or whatever support person the neonate needs to be at the bedside with them. There's also enough room that the nursing staff can perform at high levels around the family and the neonate to provide high quality care.
I think the fact that everything's, uniform as far as the layout, and then having our murals, which all are pictures of the area, just helps make it feel more homey.
In our care areas, we went with the mountain scenes because we are Mountain View. Mom and dads are in here, sitting here, worried and whatnot for months or days on end, and we wanted something nice for them to be able to look at. We have a Murphy bed in the wall in there that looks very nice, and you may not even be able to tell. It's a queen size bed that parents can use to rest when they have to stay here long term.
I think the ideal NICU has the best of both worlds. It's able to give great quality care and still make it a good place for the families and the nurses to be. And I think that's what we've done here. We have the state-of-the-art equipment that enables us to give that great care, plus the environment that is soothing for the families, that is easy for the nurses to work in, and I really think that we have the whole package.
I'm really looking forward to just being able to do more for these babies. You know, it was hard when we'd get a baby that we couldn't keep because we didn't have the equipment and stuff that we needed. So it was hard to, you know, have to send them somewhere else. So I'm excited to be able to keep more of these babies here and keep them with their families.
We had this idea in hand to be the best neonatal care provider in the area, and we needed the best equipment and resources and team, and we got it. It's awesome to be part of an organization that helps you do what you want to do, which is take care of babies in the most technologically advanced place that you can do it.
We are able to provide excellent care for these kids.